Ladies and gentlemen, forgive me, but allow me to paint to you the exact image that happens in the medical world. And this is from the medical school until the time that these students transition into the field and they start attending to you. So sit back and just go through it with me. And I hope that any medical student who is out there and who has experienced this, or even those who are in the field, can actually confirm that this is true. Okay? So, when you get into a medical school, maybe a college or a campus, and you are so excited about changing lives because the vibrance that you've pulled from high school is actually coming in handy, and the pride starts to set in because you see, they choose the students that are actually preferred or actually termed as the best in the secondary school examination, and these are the students who are picked to go and do this medical field. Of course, it's a sensitive field. It used to be a lucrative field or a prestigious field, but nowadays it's obvious that the medical field is just like any other field and it has to be challenged. And I think when we started considering it as a so much prestigious course, that's when all of us became slaves. So, this is the reality. A student moves from high school into a tertiary institution to study medicine or pharmacy or nutrition or medical laboratory or any medical field that you know of when you can mention it. So this is what happens there. When they set in, they're excited that they're going to become these doctors that will change people's lives for the better. And of course, the monetary aspect will come in handy. Because again, when you're in school and you are a medical student, everybody is having hopes in you, including your parents. And that pressure can actually be overwhelming. So you get there and you find these old professors or old lecturers who are actually the ones who are vibrant and teaching you the same things they've taught over and over, and they are so experienced in that field, and they start teaching you things. And of course, as as part of an institution that is going to change people's lives, you have your doubts about the syllabus. A good example is on diabetes and the therapy for diabetes. Every single medical student has had their questions about that treatment and about the definition of diabetes. However, no student can ask their lecturers these questions because, of course, you are a student and I am the lecturer, so you have to listen to me. I'm the most experienced here and I've been doing this for the last 10 years. So, what can you tell me? Sit back and just write notes. And then these guys read so much notes and they dictate a lot of notes to students, and that's where the bad handwriting comes in. Okay, because you're busy struggling to capture every single detail that the lecturer is saying, and you're even actually missing out the concepts. So I wish we would change that to just getting into a class, sit down and understand the concepts, and then you can go and make your own notes. But now the lecturer is there reading his notes, the ones that he has pulled from the syllabus that was written ages ago, and now you're busy writing and you start developing this bad handwriting, and then the public tells you every single day that doctors have a bad handwriting. So of course, because you're a doctor, you get to adapt that, and that's why I told you there's nowhere in the medical field that bad handwriting is taught. Nowhere. It's not part of the syllabus. It's a lie. It's just people trying to capture every single detail that is being said by the lecturer and missing out on the concepts that actually make sense. So now you're there, you can't ask these questions, because if you ask these questions, you will have another year in the medical school, and that is expensive to you and your parent. And of course, again, you don't want to disappoint a parent by staying in the medical school for a long period of time, because it's money, okay, and it's expensive to stay even a single semester in a medical school because of the retakes or the supplementary papers. So you want to be that clean guy. So of course, writing on the chair, writing the mokenyas, and just cramming and pouring on that exam paper, and you're gone. If somebody asks you what you really did in that exam paper, you cannot remember because you crammed, and now you're cramming for another exam because you want to pass. And that's the ideal situation. So you don't want to stay in a medical school for another year because you're so afraid that this will be draining to your parents. You will be seen as somebody who doesn't have the brains, and yet you got an A. So you see, so all this pressure that's coming in helps you, actually pushes you to the cramming zone and to that guy who writes more Kenya. And this is the people that I say they sit near the window just to mock what is happening there. So now you come out and you graduate. After having crammed all this through, you come out and you graduate. And of course, you're half baked because it was all about cramming and the degree was communal. Okay, it was It was a community service. Everybody was participating in it. Now you're out there on a graduation square, you take an oath that is called the Hippocratic Oath. This oath is bound to, actually is meant to protect the interest of the clients, who we call our patients. But immediately you put that oath down, you forget about it. Money comes in, pride comes in. Now you are the doctor and they are the patients. Now you've come from a medical school that you've studied for the longest period of time, and the pride just starts to set in. The ego comes in, and ego is evil. Now you think you have had your freedom. Now you've come from that medical school, and now you have the freedom, and you believe it's now time, and it's in my hands now to change lives of these people. Shock on you. You come into the year of internship where you're supposed to actually learn the clinical aspect of it and the practical aspect of the theory. Okay, so you're full of theory. Now you're here, you need to understand the basics, because no patient will ask you about the mode of action of drugs and all that. So you've left it in the syllabus, in the schools, and now you're out here for internship. But the shock is the same lecturer that you found that taught you in the medical school is the same guy who is here as your consultant. You call them consoles. Yeah? He's your consultant. And now you have to stick to what he says. And remember, from campus or from college, you are so scared of this guy. So he has actually sold you the fear. And deep within you, you have the fear. So you still find the same guy being your consultant. And in ward rounds, every medical student or every intern can bear this. In ward rounds, everybody wants to be at the back seat. They want to take the back line. Why? Because they don't want to be asked questions. They don't want to participate. They actually were pushed to be there because there are hospital guidelines that actually dictate that you have to be part of the ward rounds. So as you get into the ward rounds, this consultant that taught you in campus is the one who is leading these ward rounds, and he's busy regurgitating these new terminologies, this new research. And because he's experienced in the field, you have no option. You'll sit back and listen. And guess what? He's simply regurgitating the same things over and over. The only difference is the time that he has taken to actually cram and let these guidelines stick into his head. So now he imparts this into them, and you will only become as good as your mentor. So if this is your mentor, this was your lecturer, you will become as good as him. So what you will be doing is also regurgitating the syllabus, and you will always have the fear of questioning those people who are ahead of you. So you don't question anything, he dictates his terms to you, and because what does happen in front of patients, he doesn't want a challenge. So he puts on these walls and this serious face because he is the master, right? Yeah, so now you have to sit there and just listen, and you go out of that word round. I think about only 15% of those people who attend word rounds really get what is going on. Most of uh, those people who attend word rounds are just there for the sake of formality. You're just there to just see what is happening and maybe actually dictate some terms in terms of a patient. So when you come back to review files, the patient knows, this one I saw him is a doctor. So that's what is happening. Now, as that happens, in hospitals also, there is this thing that is called CMEs, Continuous Medical Education. Now, this, for those of you who don't know what CMEs are, these are sessions that hospitals hold, possibly once in a week or twice in a week. And what they do is every department is involved. And these departments come out with presentations to just educate the people, the healthcare workers, about new things, new technologies, uh, the updates, the new guidelines, and they also teach you about health in general. Just this is like a refresher thing. So as you attend them, you get to develop yourself professionally. However, every CME that you attend, you will realize just a regurgitation of the syllabus, and even those people who prepare and present for the CMEs actually go home and do the research, and their research is actually using the syllabus. They come and regurgitate the same things. Oh, peptic ulcer disease is hyperacidity, therefore you need to neutralize the acid, and therefore this is the drugs. The same things, nothing new, nothing exciting. Okay, and then you sit there, you listen to this, but look at this at it this way. Nowadays, most of the CMEs are not organized by the hospitals. No, the hospital just sets a date. Like on Tuesday 15th, we'll have this. It'll be a CME, and it's a CME on hypertension. And this is actually set after the hospital has been convinced by a pharmaceutical company that actually sells drugs for hypertension and diabetes. So if it's a CME for hypertension or diabetes, you will see somebody called a med rep. And these med reps are all over in hospitals, in private hospitals, in pharmacies, and their agenda is to actually market products and drugs from pharmaceutical companies. So they are sent and they are given tokens, they are given bribes, to come and bribe doctors, to come and bribe pharmacists, and all this, so that they can actually push. They call it push, sukuma dawa, to push the drugs. So it's not about your health anymore. It's about us pushing the drugs to make the profits. So these guys organize these CMEs, and they come in, and of course, for them to clean their name and for the PR stunts, they let somebody from the hospital present, possibly a pharmacist or a pharm tech. They present. After presenting, these guys have put their banners all over, banners that are marketing that company and that product that they want to market on that CME. So this CME is actually instigated by the product, okay, not the need for the healthcare providers to learn. So now they come in, you present. After you've presented, that guy from that company is the one who presents last. And all of you know, he who laughs last laughs loudest, right? Eh, so this guy comes in the last one to present his ideas. And when he's coming in, because you've already presented about hypertension, he's not coming in to talk about hypertension anymore. He's coming in to tell you the new drugs for hypertension, the new combinations of hypertension. And guess what? He tells you that these drugs are a good combination that act on different sides to help you recover from hypertension. They are affordable as compared to the drugs that are in the market, as compared to other drugs from other pharmaceutical companies. And so it's always about the price, and it's always about the new drug and the new combinations. Nobody tells you about the side effects that are coming with this. Nobody tells you about the higher dosages of these drugs, because they are, now if it's a combination, it's a problem, more side effects, right? But they will tell you the advantages, they will tell you the cost, they will tell you that this drug is going to act on different sides to help you recover from hypertension or diabetes. But you're waiting to hear them talk about the side effects. You're waiting for them to hear about how this drug will actually work to actually help you clear the inflammation that is happening in the system. But no, all the drugs for hypertension are just helping you to open the blood vessels that have been constricting. And this is just treating the symptoms. All the drugs for diabetes are just telling you how to pump sugar from blood into the fat cells that are already full. And we've talked about that before. And then these sensor med reps come after the CMEs. They come to bribe these junior doctors and the pharmacists and the clinical officers with lab coats, with pens and notebooks, prescription pads. They bribe them with lunches and some few coins here and there. And they tell them to push the drug. So each and every prescription that is being written by this person, when it gets to the pharmacy of their choice, this guy gets a commission from it. So this guy will not allow any drug from that company to expire. He will not even allow any drug to stick on the shelves for the longest period of time. And they do this all the time. They visit hospitals every end of the month because they know that the hospital is about to make the orders for these drugs. So it's all about the pharmaceutical companies. So now CMEs have lost sense, because you tell me, how will a CME be? Imagine now me presenting a CME on hypertension, and a medical representative is seated there waiting to dispense or waiting to tell you about the new drug combination. Do you think that CME will go well? It will not. So they will not choose somebody like me to present on hypertension when they know my virtues and my principles will always go on the dietary and preventive part rather than the treatment of the symptoms. So they will not allow that. But that's the ideal situation. So these students, when they're in, or these interns, they're the ones who are actually being conditioned. Remember, in campus, they were conditioned to think in a certain way. When you see these symptoms, think about this lab test, think about these treatment guidelines, the first line, second line, and all these. Just simply think according to the guidelines, and then do not do anything else apart from the research. As we provide the research, and you know very well that 90 to 98% of the research and the peer-reviewed papers actually conform to whoever funded them. And guess who is doing this research and who is funding them? The pharmaceutical companies. So you can easily see that even in Kenya, the diabetes guidelines are sponsored by a pharmaceutical company that actually produces drugs for diabetes. So if that is the schedule, if that is the plan, how do you expect to recover from this condition? How do you expect to get a medication that will actually help you heal from hypertension or diabetes, when the real case is the one who is sponsoring that medication or that research is the one who is producing the drugs? So do you think it will get better? It will not. It will get difficult because it is actually compromised. There is more research and more reviewed papers are actually compromised. And I've told you that science is evolving on a daily basis. But why is the syllabus the same? If science is actually evolving, why is the syllabus the same? That somebody who graduated in 1980s will still say the same things that somebody who has graduated in 2023 will say the same. It's because the syllabus is the same. The only thing that changes is the year. And when they review the syllabus and they bring in a revised edition, it's just the same things, only the date Only the year is the one that is changing. So sometimes when you become aware of yourself, when you know your body very well, when you know diets and how they work, it's easy for you to challenge the healthcare systems. And I push that students who are in the medical perspective start asking your lecturers those questions. Do not hold back just because you want a pass. Because you even forget the oath after coming out and it becomes money. When industries just now take your brain totally through the guidelines and through these medical representatives, you cannot think about anything else apart from making money. And I know the pressure that comes with being a doctor. Having that title alone, everybody depends on you. Okay? Everybody thinks that a doctor should have children in private schools, a doctor should have a certain car, a doctor should have a certain lifestyle. And this can really get into your head. And because of the ego, you can actually start becoming crazy. And when that gets into your head, you forget about the oath. That oath has four principles. And those four principles are supposed to be adhered to. Those four principles are actually for the benefit of the patient. There's nowhere in those four principles that we mention the monetary aspect of it. And right now, health is not a lucrative profession as such because when counties came in and all this mess just happened, you see what is happening in the health system, in the Ministry of Health. Yeah, it's not a lucrative course anymore. So start living according to your means. Do not fall for the pressure that is coming from people, from the society. And then now you have to exploit the same society so that you can live up to the name. Okay? You are a person before you became a doctor. So be that person. Do not change just because the ego has set in and the pride is coming in. So if you review this from straight from the colleges into the medical field, the internship, and now into employment, you will see that by the time this guy is being employed, he has gone through a series of conditioning that will not change your life for the better. No. It is not even going to change his life for the better. It's going to change the life of pharmaceutical companies. They will make more profits through him. So they intentionally chose the best students, the best, so that you can respect them. Because if somebody is the best in the society, he has to be respected. If somebody is a doctor, hey, he has to be respected. So they choose small individuals, a small representation or sample of individuals that are considered sharp so that they'll be listened to. And then they condition these people, and then they use these people to condition the entire masses. And that is exactly what is going on in the medical field. So by the time this guy is getting unemployment, all he wants is to recover his money that he used for school fees, all the expenses he had done. He's there to just make the money. Okay, he wants to afford the best things, he wants to live the best life, and that is where things go south. So I thought you should know this so that by the time you're trying to trust the healthcare systems, you actually can trust yourself first. You actually understand yourself before you go there for somebody to dictate terms to you. Okay, you're a better doctor than all of us. Why? Because the body speaks to you. You are the one who comes here to speak to me about your symptoms. So start listening to your body, start eating healthy, start resting, start exercising, do things that average people don't do. Start reading to build your mental fortitude because most of you don't read. You just want a doctor to regurgitate things to you. You can actually take a medical textbook and you read it and you understand it and you can challenge the status quo. But the problem is you've sat back because you're the patient. I am the doctor, so you want me to dictate everything to you. Sometimes you have those questions, but you cannot ask because you fear the doctor. Most of you fear your doctors. If your doctor tells you to grow fat, you'll grow fat. If your doctor tells you to take poisons, you'll take it without asking questions. It's time for now to start for you to start asking questions. Time is now. Ask those questions. Let them get upset. Let them get disappointed. But ask those questions because you see, in Kenya, medicines are regulated by a pharmacy and poisons board. Poisons board. So there are poisons and low doses. So as you take these poisons are not going to hurt the doctor. No, they're going to hurt you. So you must ask, why am I taking these drugs? How do they work? How are they going to be beneficial? Do I have to take them for a lifetime when I was not born with this disease? Okay, so ask those questions and let them get upset. And when they get upset or emotional, just know you chose the wrong doctor. It's time for you to seek a secondary opinion from another doctor. There are doctors who are doing a good job out here. There are doctors who have refused to stick in the rectum of the matrix and the syllabus. There are doctors who are doing things differently. There are doctors who prefer, and shout out to your doctor who prefers to tell you about diets before telling you about medication. Shout out to that doctor who takes time to take your history, to listen to you, a complete history, both family history, medical history, disease history, and all this before he makes a diagnosis or before he sends you to the lab. Shout out to that doctor who takes time to advise you about dietary and lifestyle modifications, sleep, exercise, fasting. Shout out to that doctor. But shame those doctors who don't even look at your face. When you're in that consultation room, they already started writing a prescription or a lab request before you even say your symptoms. Shame them. So I thought you should know. And I hope that from now henceforth, we can have an agreement that doctors can start coming out clean, because I know there are doctors who watch my clips. They agree with them, but they cannot come out clean to change their practice. Why? Because if they change their practice, they will lose clients. Clients will not trust them anymore. But you see, you'd rather lose a client because they do not trust you for telling them the truth than sticking with a client who trusts you and all you do is to give them poisons every now and then. I'm not saying drugs are poisons, but they are classified under poisons, part 1 and part 2 poisons. But the reality is this: drugs came in to change lives, yes, but they are not the only solutions, and dietary conditions are supposed to be treated or managed by dietary solutions. There is no drug that is coming to change your kitchen. No way. So, therefore, there's no drug that is coming to change your life in terms of the chronic conditions and the lifestyle conditions if you don't change your lifestyle and then trust the drugs. I thought you should know. Cheers.